Okay, so for this video, we're going to be talking a little bit about patient positioning. In this case, my patient is a right transtibial amputee. So the first thing that you're going to want to do is wash your hands, hand sanitize, and make sure you put on gloves. I don't have gloves right now, so for the purpose of this, let's just pretend that I do. Gloves are really important when you're dealing with a patient with an amputation, especially if you're going to be doing any wound care or changing of a bandage dressing, anything like that. So now that I've washed my hands, we will get started. So you want to make sure that your patient is in a comfortable position. This supine position can be short term or long term. For the purpose of manual stretching, we're going to do supine today. So you want to make sure that you have pillows inserted to reduce pressure sores. There's a pillow under her head and 2 towel rolls underneath her PSISs. That's going to help to unload the sacrum in the middle of her low back. There's also a pillow that is lengthwise on the side of the affected limb. You want to make sure that there is nothing underneath the knee directly because that will cause more of a knee flexion contracture. So you want to make sure that that residual limb is as flat as possible, but still being supported, nothing directly underneath the knee. The opposite limb can either be laying flat. If it is, you want to make sure that there's a pillow lengthwise underneath that leg as well to unload the heels. Or the patient can also bend the knee to help to support the low back. That's also an option as well. If you're going to do that, though, you want to make sure that your patient is not letting that knee fall out to the side, and you want to make sure that your patient is in a good, safe position. So now that we've discussed proper patient positioning, let's talk about the why. So I chose to put my patient in a supine position because with that natural curve of the lower back, supine actually puts the hip on a little bit of a stretch into extension just naturally. So, of course, you still want to make sure that everything is supported, and having that pillow underneath their residual limb will also push things into a little bit of extension as you push down on the thigh. So, that actually gives you an opportunity to give a good manual stretch, and the patient can sustain this position independently as well without that added stretch from the clinician. The other way that you can put your patient is in a prone position, which is actually the preferred position if your patient can attain that position. Having them in that position is going to reinforce hip extension because that's where the body naturally wants to lie. So they won't be able to actually push themselves into flexion, but you still want to make sure that you're watching pressure points. So underneath the hips, like the ASIS, shoulders, neck needs to be in their correct position, etc.